Hi, everybody. I am Matt Schweitzer, and we are in the AAID studio at the annual conference in Atlanta. And I'm with Dr. Matt Young, the president-elect, but in 2 days you will be the president of the Academy. So tell people who don't know you a little bit about yourself, both professionally and personally.
Yeah, I'm Matt Young. I'm here from Buffalo, New York, born and raised, and I went to University of Buffalo Dental School. University of Buffalo Dental School exposed me to implant dentistry for the first time. I remember my junior year, we had our first implant program, and our teacher, Dr. Buhite, told us about changing lives with dental implants, being able to have patients who had loose and ill-fitting dentures, and being able to give them strength and stability and comfort with their jaws and implants. When he showed that first implant slide, I said, this is what I want to do for the rest of my career.
And so when did AAID come into the picture for you?
Well, Dr. Buhite told me when I was graduating, he said, if you want to be involved with implant dentistry, you have to join AAID. And that's what I did when I completed dental school in 1999. Both my parents are educators, and they instilled in me a firm belief that education is very important. Being involved with the community is very important. They were both active in the community, and with AAID, you have the ability to have education, credentialing, and being involved with the community. So I joined in 1999, right after dental school.
And you hit the nail on the head with regards to the spirit of volunteerism, and not just join, but engage. So it sounds like you didn't just join and attend a few meetings, but you raised your hands, you took leadership roles, you got involved. Can you talk a little bit about some of the early days that led up to the more senior leadership that you have today?
Well, yeah, I got involved with AAID in 1999 when I graduated, and then shortly thereafter, I joined a New York Maxi course at NYU with Norman Cranen, who is an amazing teacher. And we really learned about the didactic side, the hands-on side for implant dentistry, and I wanted to continue my knowledge and education. I went to my first district meeting in Washington, D.C. in 2002, and there I met some amazing leaders like John Minichetti and Shankar Iyer, and those guys were awesome mentors. And so I wanted to be involved, and they said, if you want to be involved, we want you to be involved. So they really gave me some good opportunities and some good avenues where I could volunteer, I could be on education. I was on education committee at an early start, and I got to learn and hopefully contribute a lot as well.
So before we get into what you're hoping to accomplish with your tenure in 2025, tell us a little bit about your personal life, your family.
Yeah, I met my wife Soki in 2008 in San Francisco after I did my residency in Philadelphia and practiced in Philadelphia area until about 2007. My wife Soki in 2008, and after we were together for a while, she started to work at the office and help me with my implant programs and implant courses. I remember I took her to the first AAID meeting in 2009, and they needed someone helping with the silent auction for our AAID Foundation that helps our charitable arm, and she did a great job with helping with the silent auction. She was featured in the newsletter the day after the conference as a great volunteer, and it was great to be able to have family go through the process and contribute as well. Yeah, I have a great son Joseph. He's 14 now, and an amazing daughter Lily, who's 11 years old now. And they're going to be coming to our annual meeting on Friday to celebrate with us.
Oh, that's excellent.
Yeah.
So basically Saturday you take the mantle of president and will be that for a year. Obviously coming into this you are probably going to have some goals. Maybe outline some of what you hope to achieve while you're in the leadership position.
Yeah, the goals for American Implant Dentistry, I've been on the board now for executive board for 6 years and the board of trustees for 4 years before that, and district officer for 6 years before that. A lot of the things that we're going to do in the following year have been set up by our leaders before me. And we're going to carry those things on. Some of the key pillars are education. Education is of such importance, and that's why our academy is so great. We have the Maxi Course programs that I took. I lecture at the Maxi Courses now. We have more Maxi Courses and more people going through the Maxi Courses than ever before. We're also developing a Maxi Course 2 program. That's going to be set to start probably in Q4 of 2025. And that's for people who have gone through the Maxi course and now want some advanced training. We also have amazing annual meetings like we have here today. Our course offerings are great. We have main main podium lectures, hands-on programs, and really allows people to also have networking within the meetings. From this, you and John Sprague and the team have developed the Learning Management System, which is our online education portal. So people can continue to learn throughout the year while they're at home. This course in particular is going to be held on the LMS system, so people can watch it later on. The learning management system is called the Implant Institute, and it's great. You can sign in for it, log in through it through our website, and those are amazing components.
150 CE hours are currently loaded, and we're going to have probably 200, 250 by the time we get to next annual conference.
That's amazing. One of our main podium speakers, Michael Sonic, today. He just contributed one of his lectures to the LMS system on Implant Institute, and so we are off and running.
And the course that you're referring to is actually interactive. It's not a lecture format. So one of the things that we're going to lean into moving forward with Implant Institute is that interactive kind of learning, because studies have shown that 75% get more knowledge from participating in a course like that versus something that's lecture format. So we're excited to see more of that kind of format of course being put into Implant Institute.
That's amazing. And we also support the Jacksonville University Implant Residency Program. That's a 2 or 3 year program, depending where you are in your practice, and that can help you to have an implant certificate in implant dentistry. So,
and the thing that I was understanding in conversations earlier is it sounds like that's probably one of the first courses of its kind.
One of the first courses of its kind. It can be done. Some of them are done online and remote and through remote training centers. So not everybody has to go to one center for training. And it's great for people who are in practice and in their hometown and have families and want to continue their implant education. So AAID has been excellent with providing different opportunities for people in different phases of their career, so everybody can advance their implant practice.
One question about the JU course is, what does having a course like that is so specific to implant dentistry, what does that mean for the profession as a whole?
Well, we want to have excellent patient care. We want to have excellent patient care, and we want our patients to be treated at the highest level. So going through these programs, you learn implant dentistry, you learn the didactics, you learn the surgical side, the restorative side, and we can provide that for the patients and have great results for them.
So obviously you have been in AAID leadership for a substantial amount of time. We have a lot of young members that are interested and want to engage and want to get involved. What piece of advice would you give someone who has not volunteered yet? How would they get their foot in the door to start being more involved?
Yeah, I think if you have people in your area, in your hometown, they're involved with AAID, that's a great place to start. Being here at an annual meeting, you can let people know that you're willing to volunteer and contribute. Starting off with a maxi course is a great way to go. If you're just starting with implant dentistry, a maxi course is 300 credit hours. It takes you through hands-on, didactic. From there, you're going to meet amazing instructors, and you're going to meet amazing participants in the course, and then also lecturers coming in addition to the directors. So it's a great opportunity to let them know that you want to be involved and you're ready for a commitment.
Absolutely, and showing that involvement, we have a credentialing program, obviously, through the Academy. Can you go through a little bit of why achieving or trying to earn a credential would be important for an implant dentist?
Yeah, credentialing is such an important part of being an implant dentist. It's one of the main things that we have with the American Academy of Implant Dentistry and the American Board of Oral Implantology. American Board of Oral Implantology is our credentialing arm, and that's seen as bona fide credentials in many states around the country. I'm in California, and in 2012 we had the POS decision, which allows us to advertise our credentials as an expert and a specialist in implant dentistry. We currently have Texas, Florida, and 22 states that we can advertise our credentials at various levels. We really feel that we're hitting a critical mass and a tipping point where we can start to work on more states and have them see our credentials as bona fide. And so to be a credentialed dentist, one, you go through the process. It's a rigorous process with testing involved. So you're going to be a better implant dentist afterwards. After the credentialing, you can distinguish yourself as far as your peers and as far as your patients. And so it's a great way to go through training and distinguish yourself.
And especially with only 22 out of 50, and every state I believe is different in terms of how they can refer to themselves or advertise themselves. But it really sounds like a lot of the initiatives that are so important to the Academy and to you for your leadership, like Surgicore or Maxi Course 2, the Jacksonville Initiative, and the credentialing program, only continues to elevate the professionalism and the specialist element
Yeah.
that will make the argument stronger for states. So it won't be such a battle, and it will go very quickly.
Yeah, that's the way things have been moving. The first few states, California, Texas, and Florida, those all took several years. But now the states are seeing that our credentials are bona fide, and we'll be able to go through the process, and it's been going great.
So, if there is someone who has never engaged or been a part of AAID before, what are the benefits of joining?
Yeah, one of the benefits of joining, we talked about education and we talked about credentialing, but one of the best values is the camaraderie that you have. I think I've learned just as much from my colleagues walking around during an annual meeting and talking to them afterwards as I have from the main podium. You get to meet colleagues and mentors who are going through these things or have gone through them in practice, and you can talk to them about how they manage different things, practice management, how do they handle surgical training for their staff, how do they handle front desk treatment plans. So that camaraderie is so important, and it's one of the best member benefits. You have that value where you have people who want you to succeed. And I think that that's probably the most important thing. You have people who want you to do better, they want you to care for your patients, and they want you to succeed. So the camaraderie aspect of AAID is really what I feel like that sets us apart from every other organization. And that's why we keep growing. That's why our organization is strong, and we continue to have great meetings and more new members coming in.
And having the opportunity to work on behalf of the academy, one of the things that I have noticed as someone who has joined other associations before and been a part, sometimes it's a little bit of a challenge to meet those people when you first start.
Yeah.
The vibe at this group is very different. It's very open doors, very welcoming. Talk a little bit about just how easy it is to meet people when you join and engage.
Yeah, there's really great opportunities. People do want to meet new people in the academy. Something I think that you developed was we have a first-time attendee badge. So when you're a first-time attendee, you can wear that badge, and you will see if you're wearing that badge, whether it's your first time or second time. People will come up to you and say, "Hey, how you doing? How's it going? Are you having fun at the meeting?" And they want to get to know you. So I think those are great opportunities. During these programs at the annual meeting, we have a lot of workshops. Workshops are typically about 30 people in the program. So it gives you a little bit more time to meet and talk to people, the moderator, the speaker, and your fellow participants. So that's another good opportunity as well.
Yeah, I want to dig in on the workshops for a second because it is something that I think differentiates when you attend annual. Obviously, we talked about Implant Institute where you can have access to CE virtually, but here on site, these workshops, they're hands-on, actually doing things instead of sitting and listening to a lecture and taking notes.
Yeah, I agree. The lecture component is important, but then once you actually do the hands-on, you start to understand these procedures. I've run many hands-on programs over the years at AAID, from socket grafting to sinus lifts to cadaver programs, and really have helped learn, helped to educate, and I've gotten a lot out of it for myself. I've taken classes in venipuncture so I could do PRP. I've done classes in sinus lifts as well. And this year we have 49 limited attendance workshops. And right now most of them have been sold out. So this is what people want. This is what people want for their training. And this is really how you can move yourself forward. One of the great things about the Implant Institute is that we do record the main podium. So if you're doing a workshop, you don't feel like you're missing out on the main podium. You can go and then watch that later and get all the training and more than your 20 credit hours during the program. So it's a great opportunity.
So as the president of the organization, you have a large responsibility when it comes to that year's annual conference.
Yeah.
So 2025, we're going to be in Phoenix. Talk to me
about it. Yeah, we're very excited about the 2025 annual meeting. It's going to be in Phoenix around November 10th to 13th, and we're going to be at a convention center. We have an amazing hotel. We're going to have a lot of hands-on programs, maybe in that same area, 49 to 50 hands-on program. Limited attendance workshops, lectures. We have great scientific chairs with John Minichetti and Brian Jackson. They're both very experienced in running courses and programs. We also have an awesome AAID program. The AAID program will help to train your front desk team, your chairside team, hygienists, and your office managers. So it's going to be a great way to interact, to connect. We have networking opportunities. Usually on Wednesday night, we have a networking opportunity. Thursday night, networking opportunity. Same thing here in Atlanta. We have some great opportunities for there.
And who doesn't want to be in Phoenix in November? As
It's going to be
someone who lives
nice.
in Chicago, that's going to be a nice trip.
Yep, it's going to be nice. You know, we're also excited. Tomorrow night, Friday night, we have the Women in Dentistry Symposium. So women in dentistry can get together and they can talk. They can talk about what their needs are, and they can network and meet people, and then connect with them afterwards at the meeting. So we're going to continue that. We've done it over the last many years, and we'll continue that in Arizona as well.
Well, thank you very much. We had Dr. Matt Young, the 2025 AAID president. We are here at the annual conference in Atlanta. Thank you for watching.